In some ways, it's so hard to believe it's been 5 years. In others, it's hard to believe it's only been 5 years.
Right.
But this week marks the 5 years since COVID became a reality for most people, particularly here in Cuyahoga County. The pandemic brought unprecedented loss through deaths, isolation, and, of course, economic turmoil. Yet it also sparked rapid innovation, from vaccine development to exposing areas that need reform.
That's right. So, of course, senior health correspondent Monica Robbins takes a look at some of the changes that happened on the front lines of healthcare from those who witnessed all of this firsthand.
Nurse Michelle Brownlee endured grueling COVID shifts, suffocating protective gear, overwhelming patient loads, and skeleton crews left her and countless colleagues across the country scarred by frontline battle. Today, she thrives in the midst of emergency-controlled chaos, but pandemic memories aren't far behind.
Death with COVID was unpredictable. You can come in one day and your patient's fine, and then you come back the next day and you're helping fight for their life, right? In the ER, patients come crashing through the door, right? And while it has helped me, I still find it very traumatic for me. I still have a very, very difficult time, and I have to reach into my toolbox that my therapist gave me.
5 years later, Michelle looks back on lessons learned. One is life-saving on both sides.
COVID made us practice different as nurses. Every day I come here, I know I have a purpose.
Did COVID teach you anything?
Resilience. How teamwork is crucial. It's the backbone to everything we'll ever do. The bond that I have with my patients and with my coworkers, it's unbreakable.
While mental health and burnout received a lot of attention, recognizing she needs self-care is still her responsibility.
I've learned that, it's okay to have a bad day, and it's okay to take a break, and it's okay to walk away for 5 minutes to gather your thoughts. We never really had to do that before.
Dr. James Hill also served on the COVID front lines. Now as Chief Operating Officer, he sees the big picture of pandemic changes.
The system as a whole, and it's really when we came together, we stood up a hospital incident command system, and really were able to break down a lot of longstanding barriers that had existed, and we were able to really effectively treat patients and move patients across our system, move resources across our system very effectively in a way that previously wouldn't have really been thought of.
In the midst of supply shortages, hospitals learned how to find workarounds that are still being used today.
The IV fluid shortage. We had the plant in North Carolina that was hit by the hurricane. I think the lessons that we learned from the pandemic helped us manage as a system and also come together to really effectively try to govern the resources that we had, so we were able to keep treating patients, keep our doors open.
Another pandemic positive, collaboration among our hospitals. Competitors became partners and worked together to solve issues affecting everyone.
I think it's critical because it's really about the patients of Northeastern Ohio at the end of the day, and that's who we're all here to serve. And we're all much better off as patients and caregivers if everyone is basically able to treat those patients effectively. And I think, that relationship continuing to grow, continuing to flourish is only going to help the citizens of Northeastern Ohio.
Monica Robbins, 3 News.
Well, the pandemic also shined a light on healthcare disparity as Black, Hispanic, and other minority populations had a disproportionately higher percentage of death from COVID-19. And for many, COVID fallout is still not over. Tomorrow, I will show you some of the impact of long COVID and how 5 years later, some are still dealing with it. Yeah, there are quite a few that are doing that. I mean, in some ways, as we've said, it seems like it's such a distant memory, and then all of a sudden, it comes back and you're like, wow, it's only been 5 years. Yeah, it really has. And I remember March 23rd was the day we went home.
Yeah.
And you and I started that new newscast that was COVID dedicated.
Yeah.
Who would have thunk?
From our homes.
Yeah, that we would do a newscast that was just solely dedicated to all things COVID.
Yeah.
And I'm sure glad that's over.
Boy. You and everyone else. But you know what? I still feel compelled to say, wash your hands, wash your hands, wash your hands.
Well, I said that long
I know
before
you did.
COVID.
Yeah, but I didn't listen then.
Well,
now I did.
I think people are sick of hearing me say it no matter what. They were sick of hearing me say it before COVID too. But wash your hands.
I am looking forward to your other reports this week.
Thank you.
Fascinating stuff, Mom. Thank you.
Sure.